Hello everybody, and welcome to Species Specifics. Today we are going to be discussing chelonians. These are our turtles and tortoises. If you are new to this series, the goal of these lectures is to cover unique diseases of different veterinary species that are specifically mentioned in the ICVA NAVLE study guide. I've also included some diseases that are not specifically mentioned but may still come up. The focus of these lectures is on disease recognition through images, clinical signs, and diagnostic tests. I've also highlighted key, easily recognizable characteristics in bold. There are only a few notable diseases to remember about chelonians for the NAVLE, so I've put them in no particular order. We will start with septicemic cutaneous ulcerative disease. This is a condition caused by the bacterium Citrobacter frondii. Clinical signs include pitted scutes, which are the shell scales, and these scutes may slough, revealing purulent discharge from the shell. You may also see petechial hemorrhages. Treatment involves wound debridement and systemic antimicrobials. Good sanitation is the main preventative measure for this condition. Infectious stomatitis, which is also known as mouth rot, is usually caused by Aeromonas or Pseudomonas infections. Clinical signs include petechiae in the oral cavity that may progress to caseous or cheese-like material. Treatment involves debridement, cleaning the area, and antimicrobials. Mycoplasmosis has been associated with population declines in wild chelonian species. The bacteria cause upper respiratory disease in these species. Clinical signs include clear to purulent nasal discharge, lethargy, and swollen joints. Treatment involves antibiotics and flushing of the nasal passages. Oral abscesses are caseous material that can accumulate within the middle ear. It is usually associated with hypovitaminosis A, so investigating the animal's diet is prudent in these cases. Clinically, we see oral abscesses as large swellings behind the eye. Treatment requires surgical removal of the hardened pus and flushing of the area. Salmonellosis is considered to be part of the normal microflora of reptiles, and it is potentially zoonotic to humans. It is not recommended to try and treat reptiles to eliminate the salmonella in their microflora. Therefore, prevention of zoonotic disease involves assuming that all reptiles carry salmonella and appropriate hand washing after handling the animal. Fibropapillomatosis is caused by chelonid herpes virus 5, and it primarily affects sea turtles. It results in light gray to black proliferative masses on the skin, but it can also affect internal organs. Treatment involves surgical removal of these masses. There are also other chelonian herpes viruses that primarily affect tortoises. Latent carriers of these viruses can spread the disease to other animals. Clinical signs include off-white or yellow membranes within the mouth, anorexia, regurgitation, and oral or ocular discharge. Treatment involves supportive care until the animal recovers from active infection. Intranuclear coccidiosis primarily affects Old World tortoises. The protozoans invade numerous cell types, causing nonspecific clinical signs like lethargy, weight loss, diarrhea, and nasal and ocular discharge. Treatment involves supportive care and antiparasitic medications like toltrazuril. Shell trauma can occur due to interactions with dogs, boats, lawnmowers, predators, etc. It can result in large wounds in either the plastron or the carapace, or both. Treatment involves debriding and flushing, followed by surgical repair using things like zip ties, epoxy, or fiberglass. Metabolic bone disease results from secondary nutritional hyperparathyroidism. This is usually due to a low dietary calcium to phosphorus ratio or a lack of UVB light exposure. It results in shell deformities, paresis, and potentially bone fractures. Treatment involves correcting the animal's diet as well as their hypocalcemia. Dystocia can occur due to a stuck egg or follicular stasis, which is where egg follicles that have failed to ovulate form a large mass. Clinical signs include straining and vent prolapse. It typically requires surgery to treat in most cases. Vent prolapse can result in prolapse of the cloaca, colon, oviduct, penis, or bladder. It usually occurs secondary to another condition. In this condition, you will observe a large mass extending from the vent area. Treatment involves replacing the prolapse or amputating the mass in some cases. Cystic calculi are often associated with chronic low-grade dehydration in tortoises. They may exhibit things like straining and discomfort, and may develop penile or cloacal prolapse. Treatment involves surgical removal of the stone. Gout results from accumulation of urates in the organs due to excessive dietary protein, dehydration, or renal disease. Clinical signs include weight loss, refusal to move, and swelling of the joints. Treatment typically involves correcting the underlying problem. Hepatic lipidosis is the most common liver pathology in chelonians and can occur secondary to anorexia, debilitation, or ovarian stasis. Clinical signs include weight loss, diarrhea, icterus, and weakness. Treatment involves supportive care. Thank you for watching Species Specifics. If you enjoyed this video, remember to like, subscribe, and to share with your classmates. Thanks again for watching, and we will see you in the next video.